things. Well, of course, we are now coming up for our political panel. I'm very pleased to say joining me today is Jeevun Sandher, economist at King's College London and former Treasury official. Jeevun, hello.
Hello, it's wonderful to be here.
It's good to have you back. Now, and alongside you, Jason Reed, political commentator and UK lead at Young Voices. Jason, hello.
Hi, Nick. Great to see you as well.
Well, thank you both very much for joining me. Let's kick off with my old favourite subject, the BBC. Nadine Dorries, Secretary of State, she said they talk, the BBC, about lots to do with diversity, but they don't talk about kids from working class backgrounds. Well, they are today, aren't they? Jeevun, this is a good news story, even though I think it's got lots of holes in it, isn't it?
Yeah, it is a good news story, right? I mean, we've all known people...
You didn't look convinced when you said that, anyone watching.
I'm very much convinced. It is a good news story. Look, we've all known that people who have, like, you know, mediocre backgrounds, but posh, rather mediocre performance, but posh accents getting away with it. Actually, we need to broaden diversity and actually ensure we're getting the best talent within our organisations and actually encouraging that, making us aware of perhaps our own biases and where we fall short ourselves is a good way to do it. Absolutely, we should be getting children from more working class backgrounds into the BBC. Yes,
but listen, let me just ask you on that score, right? They say they've got 20% now. They say they measure that on what the parents were doing at their age of 14, but their ambition is only to get 25%. I mean, that's not representative of the society, so it's a bit weak-willed. They need to do more, don't they?
Well, I'd love them to go further, but look, 25% is a good place to start. I think absolutely push it further. And we know that journalism in particular, not very representative at all. I think only 10% of journalists are from working class backgrounds. So absolutely push it up and push it higher. It's great to see the BBC doing this. So I wish them all the best.
Jason, is this a tick box exercise? Do you approve of this positive approach to recruitment?
I think what the BBC is doing or says it's doing is definitely a good idea. The question is whether there's an issue of a risk of virtue signalling here, because saying you're going to do something is much easier than actually going ahead and doing it, especially when you're dealing with something as complex as social class and socioeconomic background. Sociologists have been debating for decades and centuries, and probably will for decades and centuries in the future, about how to measure or categorize social class. It's not as easy as just here's one number that tells you how many working class people there are working in the BBC. But even if they were coming out and saying 95% of people who work for the BBC are going to be working class by X date, we still need to see some actual results, some actual actions to back that up, because it's otherwise we are going to let them off the hook. But I'm very confident that Nadine Dorries, even though I often disagree with her, I'm very confident that she will hold the BBC to account on this quite effectively.
It's quite interesting because the BBC say that they want to represent their licence fee holders, which is pretty much all of us, if you think about it. So they want to represent the country. Now, in strict terms, their diversity specialists today have focused basically on people from different ethnic backgrounds. They haven't, according to Nadine Dorries, if you like, talked about people from working class backgrounds. If they were being truly diverse and wanted to reflect the country they represented, we'd have, what, 48, 49% of the people at the BBC from working class backgrounds. So they're underachieving, aren't they?
They are potentially, well, they're definitely underachieving at the moment. And potentially you've got a point that the target they've set is not high enough. Perhaps we need to see a longer term framework for how, once we've hit the 25% target, then what about 30%?
But you're a conservative. You don't like targets, do you, Jason?
Of course I like targets when they achieve good things. Conservatism is all about pragmatism. And if it means helping more working class people get involved in the BBC, that's a good thing. I think the problem is that it's obviously a bit more fundamental than that, that even if the BBC was totally representative of the country, the problems run much, much deeper with the licence fee funding model and how regressive it is. And we need to look at that very, very seriously. This all stuff about representation and diversity is just icing on the cake, really. It distracts potentially from the real issue. And that's why virtue signalling is such an issue. But on the face of it, in isolation, having more working class people working at the BBC is certainly not a bad thing.
Jeevun, targets, says Jason, can be a good thing, but as we've now learnt neatly with a subject change, targets were a disaster in the NHS, in Shropshire, in the maternity ward. They were considered a key failing and cause for the deaths of over 200 babies and 9 mothers. I'm saying bluntly today, Jeevun, if we've got to the state where the NHS is killing babies, the game's over. It's time for utter comprehensive reform of how we do healthcare in this country. That requires politicians to get together, ditch this argument of left and right, privatisation versus non-privatisation. Do you agree?
First of all, I would of course echo the sentiments in terms of the grief those mothers must have faced. I can't imagine what that must have been like to go through. And clearly there are terrible failings there that absolutely need to be addressed. There absolutely needs to be accountability. I think it's also clear that the NHS does need restoring. The NHS has certainly not performed very well. Waiting lists for surgeries are doubled in the decade leading up to the pandemic. Those waiting at A&E for more than 4 hours up by 5 times. Really, there's at least 2 reasons for this. The first of which is funding. So actually, we've seen nurses have a pay cut in real terms of £2,500. That's why there are 40,000 unfilled nursing vacancies. There also is wider deprivation problems. When you're struggling to put food on the table and heat your home, as a third of the people in this country you are going to have health problems. And there are problems with the organisation of the NHS. We certainly need a long-term model. We also need not this kind of constant change in organisation when a new government comes in. So absolutely, we need to restore the purpose of the NHS. And I hope that actually is now kind of a wake-up call that we should do so.
Sorry, Jason.
We do absolutely need to reform the NHS, but it's going to require some quite bold and quite scary decisions. If we continue down the road we're going at the moment, the NHS is going to become this huge, it's just going to continue to balloon as funding increases. And of course, it then fails, as we've seen with tragic consequences in terms of healthcare outcomes. Our debate about healthcare policy in this country is completely and utterly broken. If we think back to the last general election in 2019, when the Labour Party tried to frame its campaign around the NHS and tried to make out that the Tories were on the verge of selling the NHS to Donald Trump, which of course turned out to be total hogwash. It was complete nonsense. This fear that people seem to have of anything to do with the private sector, of any kind of privatisation, is standing in the way of NHS reform. It is resulting in our healthcare outcomes being much, much lower than they should be, and it's resulting in us paying much more in taxes than we should towards the NHS, or than we need to, and therefore making us much poorer, worsening the cost of living crisis. Reforming the NHS would benefit absolutely everyone. There are no arguments against it, except for the difficulty of actually going ahead and doing it.
Jason, across the channel, you look at Holland, you look at America, they have completely different funding models. They are paying roughly the same as a share of GDP as we are. They have more GPs per 1,000 head of population. They don't have the waiting lists we have. They're frankly doing better than us. And we, in the Commonwealth Health Funding Survey of 11 key leading nations, right, we were at bottom for outcomes. Why are you rehashing the old argument, the old politics about more money, more this, Tories bad, Labour good, left good, and not talking about outcomes?
Exactly right, Nick.
I'm asking Jeevun.
Sorry.
Well, the reason we should absolutely be addressing outcomes. Firstly, I don't take your point on spending. The UK spends about 10% of our GDP on health. The United States, 16%, and they have worse outcomes. I do agree we have to address outcomes. But one problem we have had in this country is that our spending as a percentage of GDP, health, has remained constant in the decade leading up to 2020.
Sorry, you're doing the old argument. I'm going to interrupt you, Jeevun, because I'm going to correct you. No, Jeevun, I'm going to interrupt you. Jeevun, I'm going to interrupt you because you do not make claims like that. This is it. Go and read the Commonwealth funding thing. You'll see all that blob of lines together there. There's your America failure. Totally get that. I didn't bring America into this. You did. I brought our neighbours in Europe. Here they are. Right, all spending roughly the same. Now, my suggestion to you is, isn't it time to ditch these arguments about how wicked the Tories are over the last 10 years? And when you do that, just remember, on the Shropshire Hospital Trust, it's been going on for 20 years. Last I remember, half of that was you lot.
Right, Nick. First of all, I think you did big up the United States of America. But secondly, when it comes down to Shropshire, of course, there were huge failings there. There was also a question about how to fix and reform the NHS, and actually, like, some good ideas there, I would say so. Funding, wider deprivation, and whatever organisational changes need to be made. We saw with those Landsey reforms too much being pushed onto GP surgeries, but actually they had no interest in commissioning care in the way they were forced to. More paperwork and more bureaucracy. Whereas actually the old model of trusts, where actually you kind of had the bureaucrats doing said bureaucracy, was a good model to have.
Jason.
I agree entirely with what you said, Nick. You took the words right out of my mouth. There's the people on the left in this debate, they always refer to the US and the failures of the American model. The Labour Party did it in 2019 and has been doing it for a very long time. It's just entirely typical. It's not some kind of set menu where we have to choose either the British or the American. You mentioned Holland. There are countless other examples of successful healthcare systems that look very different to ours, that are much, much better, that take better care of people. I don't know why we wouldn't put everything we have behind that rather than blindly subsuming this kind of national religion.
Jeevun, interestingly, and by the way, I'm absolutely certain I didn't mention the US. I talked to us across the water in Europe, but if we look back and I'm wrong, I apologise in advance, but I'm pretty sure I didn't. But anyway, on the key point here, we have health rationing in this country because basically we give it free for all pretty much to everyone in the United Kingdom. And yet no one will admit we have health rationing in this country. Isn't that part of the problem? That's why we end up with waiting lists. That's why they draw up pathways in a way, because they know that that's the number of people they can treat, the number of MRI scanners. People aren't actually being honest in the healthcare system themselves about what we are doing in the people's name.
It would always be rationed, whether that was by kind of the private sector or the public sector.
Well, other models will allow it not to be as much, though.
It would be, this case would be that actually some people wouldn't be able to kind of get the treatment that they need. There's always going to be this kind of problem in the sense that we do or won't always have every treatment available at the time, but we can certainly do much better than we are doing at the moment. Certainly much better when waiting lists are so much higher. So there is a better way. And look, in terms of a public funding model, the idea that anybody, no matter what their background, no matter where they're from, will get the treatment they need.
But that happens in Holland.
That happens in France.
But that happens in Holland. It's a statutory insurance system topped up by government. Anyone under 18 gets access, and then you have options over and above that. But there is no access to healthcare problem in Holland.
Sure, the access bit, but the bit is the private options on top. And
no,
I think
it's
Germany
not.
also
I mean,
has
the
a
list
similar
of them is huge. I mean, it really is huge. And I lived there, by the way, so which is why I've got the advantage, and I'm picking on you a little bit. What I'm saying is, do we not need to open the political minds and, look to our neighbours, right? And our neighbours, I mean the Holland, the France, Germany, learn from them. They don't do everything perfectly, but you can't do that unless you ditch the left-right divide. And that's my problem. I think you're pushing the left-right divide. Now, Jason, perhaps he's on slightly less contentious ground, but he's not pushing the drive. Could I sit you two in the room and you ditch the arguments about privatisation, about who funds more, and actually start from outcomes? Start with you, Jason.
Absolutely. I'm happy to meet up with Jeevun anytime. We'll sort out the NHS. In one afternoon, I reckon we could bang it out. This is just the same arguments we hear again and again from the left, isn't it? That we can't touch the NHS, we can't do anything because then that involves selling it to America, which of course just is a fundamental misunderstanding of how the public sector works to begin with. You're always going to have interaction with the private sector. Let's do it in a more helpful way that improves outcomes. I don't know why you disagree with that.
Do you disagree, Jeevun?
I don't think I ever mentioned privatisation or selling off the NHS. My issue is in terms of I will always want a publicly funded healthcare system that does provide it at the need to whenever you kind of need it. Now, if there is a case that did certainly happen before under Labour governments where it eases waiting lists, for example, to have a private operator do a certain operation, I don't object to that at all. I think actually, if that reduces waiting times, then so be it. There can be a problem when it's far too widespread, but certainly I'm not against private involvement to kind of the nth degree at all. No way.
I love having you two on. I think it's fantastic, it's lively, and better still, it's thoroughly informed, and we do benefit from your experience. Thank you so much, Jeevun Sandher, Jason Reed, joining me today for that debate.